so it's very useful for your exams and clinical understanding. Hepatitis B e-antigen, HBeAg test. Introduction. Hepatitis B is a serious viral infection caused by the hepatitis B virus, HBV, affecting the liver and leading to both acute and chronic disease. Among the various serological markers used in the diagnosis and monitoring of HBV infection, HBeAg, hepatitis B e-antigen, plays a critical role. HBeAg is a secretory protein produced by HBV during active viral replication. The presence of HBeAg in the blood strongly indicates that the virus is multiplying rapidly and that the infected individual is highly infectious. This test is vital for determining disease stage, prognosis, and infectivity status. Number 2. Definition. The hepatitis B e-antigen HBeAg test is a blood test that detects the presence of HBeAg, a viral protein produced by HBV-infected liver cells. Positive HBeAg suggests active viral replication and high infectivity. Negative HBeAg may indicate reduced viral activity, but can also be due to certain viral mutations. Indications. Doctors order the HBeAg test in the following scenarios: diagnosis of acute or chronic HBV infection, monitoring disease progression in chronic hepatitis B, evaluating infectivity, i.e., whether the patient can transmit HBV to others, pregnancy screening in HBV-positive mothers to assess the risk of transmission to newborns, assessing treatment response during antiviral therapy, differentiating between active and inactive HBV carriers. 4. Used for the HBeAg test is used for public health control, identifying carriers who can transmit HBV, clinical decision-making, deciding whether to initiate antiviral therapy, epidemiological studies, determining HBV transmission rates in populations, predicting long-term outcomes. Patients with persistent HBeAg positivity are at higher risk of cirrhosis and liver cancer. Measure 5. Why do need of this test? This test is necessary because HBeAg is a direct marker of viral replication. It helps determine the risk of liver damage and complications. It guides treatment decisions, e.g. starting antivirals like entecavir, tenofovir. It prevents vertical transmission from mother to baby. It helps in blood donor screening to reduce HBV spread through transfusion. Number 6. What happens during test? A blood sample is taken, usually from a vein in the arm. The blood is sent to a lab where it undergoes serological testing using methods like ELISA, enzyme-linked immunosorbent assay, chemiluminescent immunoassay. Results are reported as positive or negative. 7. How long for my results? Results are usually available in 1 to 3 working days, depending on the laboratory. In urgent cases, some labs may provide results within 24 hours. Prepare for this test. No fasting or special preparation is required. Continue usual medications unless instructed otherwise. Inform the doctor about previous HBV vaccination or treatment, any history of liver disease. 9. Risk to the test itself is very safe. Risks are only related to the blood draw, slight pain or discomfort at puncture site, small bruise or swelling, rare cases of infection or dizziness. Number 10. Normal values. Negative, not detected. HBeAg is absent, indicates low infectivity or inactive HBV infection. Positive detected, HBeAg is present, indicates active viral replication and high infectivity. Reference ranges may vary slightly depending on the laboratory method used. 11. Interpretation results. HBeAg positive, active HBV replication. Patient is highly contagious, associated with high HBV DNA levels, seen in early acute infection and during chronic active hepatitis B. HB negative could mean viral replication has stopped, inactive carrier state. OR could indicate pre-core mutant HB infection, virus still active but not producing HBeAg. Needs confirmation with HBV DNA viral load test. Number 12. Factors affecting results. Precore or basal core promoter mutations in HBV cause negative HBeAg even when replication continues. Stage of infection. HBeAg is positive in acute early infection but may become negative in late stages. Laboratory technique sensitivity affects detection limits. Immune system status. Immunocompromised patients may show atypical results. Number 13. Clinical significance. Positive HBeAg, high infectivity, important for preventing transmission. Poor prognosis if persistently positive. Greater risk of cirrhosis and hepatocellular carcinoma HCC. Indicates need for treatment in chronic HBV. Negative HBeAg, lower infectivity, may indicate recovery, especially if anti-HB antibodies are positive. But in HBeAg negative chronic hepatitis, patients may still have active viral replication, mutant HBV. Number 14. Know more. The HBeAg test is not used alone. It is always combined with HBsAg, hepatitis B surface antigen, confirms infection. Anti-HBs antibody indicates immunity. Anti-HB antibody indicates seroconversion, good sign. HBV DNA, viral load, confirms viral replication. HBeAg is crucial in pregnancy. If mother is HBeAg positive, risk of transmission to baby is up to 90% without vaccination or HBeIg, hepatitis B immune globulin. None of 15. Conclusion: the hepatitis B antigen HBeAg test is a key marker in the management of hepatitis B. Positive HBeAg indicates active replication, high infectivity, and need for careful monitoring and possible antiviral treatment. Negative HBeAg may indicate recovery or inactive state, but must be confirmed with HBV DNA testing. Thus, the HBeAg test is crucial in diagnosis, prognosis, treatment planning, and infection control for hepatitis B. Thank you. Have a nice day.